Alrighty, well, hello everybody, this is Dr. Bulow with Revive, and I don't know if you knew this or not, but in October we actually have something called Bone and Joint Health Awareness Week. You know, it's something that there's a lot of clinical practitioners and organizations do in the United States, is talk about just raising awareness on health issues relating to bone and joint diseases. In our clinic, as a chiropractic clinic, one of the things we see a lot of, or we hear a lot of from our community, is patients that have bulging discs, herniated discs, neck and back pain. And disc issues are really serious issues, and I wanted to give you just a little bit of an insight as to what causes disc issues. So, if you have someone in your life that you know has a disc issue, if you have a disc issue, or if you just want to help raise awareness for bone and joint health awareness, please share this video. You don't know who might be watching that could benefit from this information. So, with that said, let's get started. And I'm going to talk about the neck, but just so you know, your lower back in a lot of ways is like your neck, just a lot bigger, okay? Now, if we look at the neck, this illustration here is a person looking in this direction. So if you were looking at my own neck from the side, the bones themselves should actually be arced forward towards the throat. Same thing in the lower back, should come forward towards the belly. Okay? When a baby is learning how to crawl, an infant, they pick their head up. That's one of the theories as to what might help that curve in the neck begin. And when they get on all fours, their belly sags. Again, that might be why or how that lumbar curve starts to come in. These are normal and natural things. The reason I bring it up, let your babies spend time on their bellies. Let your babies spend time on their hands and knees. Don't put them in those little cute little chairs that make them sit up right away. They need to build those muscles. They need that belly to relax. So just a little tidbit of information. The little walkers and the chairs, those are very cute and adorable. However, these curves, as we'll see in a minute, are really important. So let your child develop naturally as if it didn't have all that technology. Going on. The curve is like a big spring in your spine, and it's supported by your discs, right here. Those discs are like little cushions, little jelly donuts in between the backbones. And behind those backbones runs your spinal cord, which is pretty important, you know. Your spinal cord is like the power cord to your appliances. That's how I teach my kids, you know. If you think of the word cord, it kind of reminds you of a power cord. That's what gives your body life. It gives it power, you know. The brain sends those messages down the spinal cord, out the nerves, to every organ, cell, and tissue in your body, and that's kind of what keeps you going. So the job of your spine is to keep you upright, give you a little spring, but also to protect your spinal cord. Now here's what happens. Maybe through trauma, accidents or injuries, or through what we like to call tech neck. So when you're sitting on your phone, hopefully you're not watching this video like this, right? When we are at laptops, or we have our cell phones out, or our iPads, remember, this is me right now, and watch what happens when I do this. My neck comes forward, and it's okay to tuck my chin down, but if I bring my ears in front of my shoulders and my head is looking straight down, one of the things that it causes is the curve in your neck to reverse. Now sometimes, like I said, that can be due to repetitive poor posture or tech neck. It could be due to traumas, and what we find in our work, it can be due to misalignment and instability in the weight of your head. So even though you want to stand right, over time your head slowly does this. Kind of like the senior citizen that has the big hump in the back and their head is forward. That doesn't happen overnight. That's a slowly progressive problem that we definitely want to address and fix. But here's why. Here's what happens. Whether it's due to trauma, whether it's due to tech neck, the weight of the head comes forward, changing the curve in the neck from being in this direction here to being in this direction here. If you think of it like a banana, all bananas have curves, right? If you took a banana for breakfast and you tried to straighten the banana out or change the direction of the curve, one of the things that happens is those discs, those jelly donuts, get wide in the back and they get compressed in the front, and so that disc comes backwards. Now when that disc bulges out in the back, you see what it hits? It hits the spinal cord, and that can create some significant problems. Neck pain is just the tip of the iceberg. What eventually happens in a lot of cases is we get numbness and tingling down into the arm, into the hands. Worst case, we get weakness and muscle wasting. Same thing in the legs, numbness, tingling, and pain, weakness in your muscle strength, and wasting of the muscle tissue. Also, those nerves go up into the head. So a lot of people with bulging disc issues, it can be the cause of some significant facial pain syndromes, migraine headaches, and things of that nature. Now, pain is bad enough. Over time, though, with all the weight of the head, when you lose that natural spring, the discs slowly begin to deteriorate. And it's like that big jelly donut turns into a stale peanut butter and jelly sandwich and turns into beef jerky after that. It just slowly loses its height, slowly loses its bounce and its water, and eventually you get into this position where you've got some permanent arthritis. And we can still help those people that have that arthritis, but the bone position will usually, the bone arthritis will usually never change. So the reason we go over this stuff is that you can influence this. You can correct your posture so that it doesn't get any worse. You can correct your alignment. You can correct what we call spinal subluxations. Those are the stuck individual vertebrae that are irritating the neurology, keeping that brain, that power cord, remember, from communicating and giving life to your body. So it's a very significant issue, but it does have some specific solutions. Obviously, you want to sit up nice and tall. You don't want to slouch. You want to hold your technology in front of you, not in your lap. When you're driving in your car, you don't want to have the car seat back because it'll make you lean your head forward to see the road. You want to have the car seat up so it brings your head up so you're looking straight ahead. But most importantly, you want to have professional guidance. Some things you can handle on your own, but specific wedges and twists in your neck, they're not going to come out on their own just by improving your posture. Improving your posture helps, but what you really need is someone to do a very close evaluation, and that's kind of where that's the hole we fill in specific chiropractic care. In our office in Upper Cervical Chiropractic Care, we start with the weight of your head, because we know that the position of your head is going to dictate the position of your spine. And so if you have any questions on that, please leave it in the comment section below. If you are outside of the greater Pittsburgh area and you'd like to look into some professional help, again, message us, comment section below, your zip code, your contact information, and we'll find you a professional in your area. But otherwise, thanks for watching, and we'll keep these things going. We did an interview last week, or yesterday actually, with a cryotherapy. That was kind of fun. And if you have any professionals you want us to interview, or you have any specific questions you want me to go over, let us know that too. And we'll talk to you next time. Have a great weekend. Bye now.